shameless plug, I teach a breastfeeding or infant feeding 101 class. And this is exactly what I do. I talk about, like, I think the most important thing that you can do, and I don't care if you take my class or someone else's, but the most important thing you can do is to plan and have appropriate expectations, because I think so many people are like, breastfeeding's natural's easy, and they just assume that everything's going to go great. And I will say that those moms where everything goes great are the exception and not the rule. More often than not, there's some amount of struggle, but learning how to latch a baby. If you've never breastfed before, learning how to appropriately latch a child is not easy. What those first 24, 48 hours look like, that it is normal for your baby to lose weight. It is expected, and it is good for your baby to lose weight because they have to pee out those fluids. So all of then what to expect each day. And that's stuff. And so finding a class somewhere so you can learn what to expect, what is normal, that your baby's stomach holds a teaspoon at a time with their first day. Like, they hold drops. And I think that is something that people don't expect. And they're like, oh, why aren't you taking? And if for some reason they do get a bottle and they get 2 ounces on day of life 2, when their stomach can now hold 10 to 15 milliliters, and they get a full 60 milliliters, well, of course they're going to pass out for hours because they just had Thanksgiving.
Right.
And that's what we all do after we gorge ourselves, is we pass out. So just setting those expectations so okay, this is normal. This is not, my baby's not rejecting me. My baby isn't, my milk's not bad. It's not that I'm not producing enough. There's, I think it gives people more confidence in their decision if they know that, like, yes, Dr. Hughes said this would happen. So here it is. And now it's less of a panic, because I think that especially your first child, when you have a baby for the first time, you're like, oh God, I'm messing everything up. And that's, I think that's our default. And so knowing that, like, this is normal and expected is helpful.
And Dr. Hughes, the class that you're referring to, is it available online?
Yeah. So I do it online with Oh Baby KC, and it's virtual and on Wednesday evenings. So I think the next one we have is
April 7th. Great. Okay. Well, that's awesome. So you're already starting to share some really great resources, and I'll make sure I get a list from you and I can post it on the site also. That's amazing. And now that you've mentioned that, I'm also thinking that one of my cousins is expecting a baby. So this will be a nice thing for her. So I'll definitely hook her up with that.